Good morning, good afternoon, good evening, wherever you may be in the world. My name is, Korean name is Seong-Hoon, but English I have a English name, Anselmo Lee. You can call me Anselmo. I'm very happy to be here today as a moderator of Session 2. Session 2, as you know, topic is older persons and humanitarian crisis. I believe you enjoy the yesterday session opening and the Session 1, which is a health crisis related to COVID-19. And this is the second one. As we know, this afternoon we are going to have a third thematic session, the older persons in climate. So we have a 2H, 1C, health, humanitarian, and climate. So on this topic, we have invited 4 distinguished experts on the issues of the humanitarian crisis from different perspectives. Let me introduce one by one. So they have a 20 minutes presentation, and then we'll open the floor for Q&A and also hopefully interactive dialogue among the 4 speakers and also some participants. This session is very meaningful for me because I'm approaching the age of older persons. And so I'm getting more interested in the topic of the human rights of older persons. And every day I live with my mom, who is 90 years old. So this is a day-to-day reality for me, you know. And also, I was an active member of the civil society group on ASEM. So this is a global aging center, which was born several years ago. But as you know, ASEM was born 1996 in Bangkok. That time, there was no civil society consultation process. But it was only in 1998 in London, the second ASEM summit. I was in London. And then, as you may remember, year 2000, ASEM summit took place in Seoul, South Korea. 2000. I was a member of steering committee at that time. You know, since then, I've been engaging this ASEM civil society process. So I'm very happy to be part of this ASEM process, particularly on the topic of the human rights of older persons, which is becoming more and more important and relevant in today's world, particularly in Korea and Asia elsewhere. So let me introduce first speaker. As you see in the program, the Matthew Wells from Amnesty International. He's a deputy director in the Crisis Response Program at Amnesty International. He has authored many the books and also a lot of the practical experience on the grounds. So Matthew Wells, are you online? So good morning, good afternoon. Are you in London now? Where are you now?
I'm in Washington, D.C.
Washington, D.C. It must be evening.
Yes, that's
okay,
right.
So good evening once again. Okay, so welcome. So you have about 20 minutes for your presentation. Okay, over to you.
Thank you very much. I'm going to share my screen as I have a PowerPoint to guide my talk. Is it coming through now? Can you see my screen, the PowerPoint?
Okay, please go ahead.
Perfect. Great. So, traditionally when talking about humanitarian crises, the focus is often on what happens after displacement, on the particular challenges that people face when living in an IDP camp or a refugee camp, for example, or even with host families. And I'm going to talk a bit about this today, but I actually want to start with the experience of conflict itself, which is what a lot of my work focuses on, the specific ways that armed conflict affects different parts of a population, including older people. And it's often at this moment of conflict itself that we see the first point of extreme risk for older women and older men in humanitarian crises. And often a quite high risk that I think is often not recognized, particularly related to older people. And the specific experience that older people have in conflict situations is then key to understanding the humanitarian challenges and risks that they then face in displacement afterwards often. So I'm going to start with a few specific examples. I've done a lot of work, for example, on the conflicts in Myanmar and the Rohingya crisis in particular. And what hopefully you can see now on the screen in front of me is a mortality survey that was done in relation to the Rohingya crisis by Doctors Without Borders. And if you look in particular at the mid level from 25 August to the 24th of September, that was the period of the Myanmar military's operations in 2017 against the Rohingya population. And in particular, if you look at the middle column, deaths per 10,000 per day, what we can see is that those who were 50 years and older died at enormously disproportionately high rates compared to other parts of the population, 3+ times the rate as other parts of the population. And overwhelmingly during this period, what we're talking about is violent deaths, deaths from a direct result of the military's operations. And I think quite often we perceive that older people are less at risk in a situation of conflict, that they receive some sort of protection because of their older age or status. In reality, what we see in places like Myanmar, and this comes up in a number of other contexts that I've worked, that older people are actually disproportionately at risk of being killed during the immediate conflict period. And a second slide, which shows similarly, and again, if you look at that period in the middle of 25 August to 24 September, the key stat is the weighted proportion, which is here is the estimate of the percentage of the older population, or all of these different parts of the population, who died during this one period. And it's over 5% of those who were 50 and older who, based on this quantitative study, are believed to have died as a result of the Myanmar military operations during that period. And again, it's enormously disproportionate compared to children and those of later childhood and adult age that we normally, I think, often perceive as actually being at greater risk than older people. But in reality here, and again, in many other places that I've worked, the stats actually bear out a very different reality. And I know there's a panel later today on environmental disasters, climate change disasters, so I won't touch on this in detail, but just to say that there's an enormous body of literature that shows similarly that older people face disproportionately high risks for a wide variety of other types of crises, humanitarian otherwise, including things like the Ebola outbreak, tsunamis, earthquakes, wildfires, flooding. So again and again, I think we need to challenge our assumptions around the experience of older people in situations of conflict. And one key thing here is that we need to understand that the experience of older people is not homogeneous, and the decisions that they make in situations of conflict are likewise not homogeneous. I think oftentimes there is an assumption or a belief that some older people are at risk because of intersections with disability, because they have reduced mobility and are unable to flee, for example, when a humanitarian crisis or a conflict takes place. And that's certainly the case, but for many older people. But for many others, there's actually a very different reasons why they often find themselves at particular risk in the first place. In many people that I've interviewed, older people are often chosen to stay behind because they're seen as less at risk, and so they're tasked with protecting cattle and farmland and other property of a community. Oftentimes, older people have disproportionately strong ties to home and to land. They've lived in a particular village for 50, 60, 70 years, and so are more likely to choose to stay behind in a village when a conflict or some other sort of humanitarian crisis takes place than other parts of the population. And what hopefully you can see in the picture here is an older man whom I interviewed in Myanmar who had stayed behind with several other older men to look after the village's cattle. He had a hearing impairment, and when fighting took place near the village, he didn't hear the fighting, and so stayed at home and didn't leave when other people left. And then when the military came in and found him and only one other person still in the village, he was tied up to a tree. What you see on his wrist are scars from where he'd been tied against the tree and beaten. And it relates to the fact that older people often have very specific risks in the situation of conflict and humanitarian crises. In Northeast Nigeria, where I have done a lot of work, again, older people often have lived in a place for decades. They provided for themselves through farmland for decades. And so the idea of being displaced at a moment of a conflict is a very difficult one, and one often that they choose to stay behind because they know that they can maintain their livelihood there in a way that will be much more difficult in an IDP or a refugee camp. One other issue that we have focused on a lot in my recent work is also the specific risks related to detention that older people face in situations of conflict. In Northeast Nigeria, for example, there have been hundreds, if not thousands, of older men in particular, and some older women who have been detained in the context of the conflict. And in that detention, they have faced horrific conditions that include extreme overcrowding, extreme heat, little water, little food. And these pose, of course, particular risks to older people. And so as we see here, and I'll read it out, a quote from a 69-year-old man whom I'd interviewed in Northeast Nigeria who'd been detained by the military for 2 years. He said, quote, "So many older people died. They couldn't resist hunger. They couldn't resist all those things. Sometimes we'd see someone collapsed and we'd put some water on them to see if the person died. When it was dry and hot, people were dying too much. There's no consideration for older detainees." And again, I think we very rarely think about older people in the context of military detention in situations of conflict, but it's a reality in many of the places where I have worked. Another issue I want to touch on is the specific relation of older people and often the trauma that they face in humanitarian crises. Again, given these deep ties to home and lands, there's often a particular trauma or psychosocial harm linked to the separation from home and land. Oftentimes, older people whom I've interviewed have been displaced not once, but twice, 3, 4, 5 times over the course of their lives from different iterations of a conflict or humanitarian crisis. Amongst the Rohingya I interviewed, for example, more than 70% of the older Rohingya I spoke with had been displaced multiple times in the course of their life. And that repeated displacement then has a particular psychosocial impact, a particular effect on both physical and mental health. And the other thing that older people often face in situations of conflict is that not only do they experience violence directly themselves, but they're often witnesses to crimes committed against their children or grandchildren. And the amount of harm that inflicts and what that means, again, from a psychosocial perspective, is really unique for an older population in particular. And many times they then end up as primary caregivers to grandchildren because an adult son or adult children may be detained or killed in the course of conflict, and then they have to take over the role of being a primary caregiver. And these, again, often then aren't realized in humanitarian situations. And again, I want to share quotes from a woman I interviewed in northern Myanmar who was 62 and had been displaced 4 times in her life as a result of conflict. And what she said, quote, is, "We had to start all over again and again. We had to borrow some money from the locals in each place we fled to. When we built up our lives, then we fled again. When I think about it, I want to cry." And it's this key thing that for older people, we need to recognize that there are often particular risks and particular forms of harm that are often compounded over a long period in which they have faced multiple iterations of a crisis, not just often, this being whatever the current crisis is often not the first one. So in terms of the experience of conflict itself, before I turn to some of the humanitarian response issues, some of the key takeaways from our work is that there needs to be far better planning done that takes into account the specific risks and needs of older people. That older people, while again not homogenous in any ways, but are often making different choices from other parts of the population. Their lived experience is different. Their preferences are different in terms of, again, where wanting to stay in a village, for example. And so we need to better understand first by listening to older people themselves, and then to design response that's rooted in their specific experience and their specific needs. So it starts with engaging and listening. And the second key thing here is that, when humanitarian access restrictions, which are very common throughout the world, including in places like Myanmar and Northeast Nigeria, means often that a humanitarian response is based on centralized points, an IDP camp or a refugee camp, and assistance getting there. But when many older people are making different decisions and in fact choosing to stay behind in a village, getting humanitarian assistance to a centralized site is not good enough. It's not getting it to where many older people still are. And so there's a need then to push back much harder on humanitarian restrictions. When we allow governments to restrict the free flow of aid, that often has a disproportionate impact on older people because it's not reaching the places that they are most likely to be. And again, around psychosocial care and recognizing the particular harms, particular forms of trauma that older people are most likely to face, and the fact that this is often not recognized when building physical and mental health responses in situations of crisis. So in terms then of moving to the humanitarian response itself, oftentimes when I've gone into refugee or IDP camp settings, I hear things like older people are only 3 to 4% of the displaced population. I heard that repeatedly in Bangladesh in the refugee camps. Only 3 to 4% in this case meant more than 35,000 older women and men. We're often casting aside very large parts of a population because they're seen as smaller in terms of the percentage of the overall displaced population. In Northeast Nigeria, likewise, it was 7+% or 60 and older, which is more than 125,000 older women and men who were displaced internally in Northeast Nigeria. And again, what we see is that the most basic of rights are being neglected of older people in situations of humanitarian crises. From sanitation to health to food and water to the most basic right to participate and to be included in consultation, that these are systematically often being disregarded in humanitarian crises. And so much of this comes back to the initial collection of data and the design of humanitarian programs. And if it's not gotten right at the first stage in terms of including older people in interviews and response, that then everything that comes after is doomed to fail. I want to show a couple quick pictures of the refugee camps in Bangladesh, and you can see just how hilly the terrain is, and often then how particularly challenging that is for older people, particularly older people with reduced mobility, to navigate. Here's one, for example, of a shelter where I interviewed an older man and an older woman, and you can see just how steep the incline and decline is going in and out of the shelter. There's nothing to hold on to, no railing, no nothing. And the older man and older woman who lived inside there had little to no ability to leave the shelter to get to a food distribution point or a health clinic, or even to go to a toilet that was several hundred meters away. And so they ended up basically confined to the shelter because of the poor planning and design of the humanitarian response. And this ultimately goes to a core issue of just basic dignity, that by a failed humanitarian response or humanitarian response that doesn't adequately include older people, we are denying the most basic of dignity. And this is an older man that I interviewed again in the refugee camps in Bangladesh, who was in his early 90s. And the quote here is one that has stuck with me and will always stick with me. He said, quote, "I go to the latrine here, I eat and sleep here. I have become like a cow or goat. What more can I say? Cows defecate and urinate in the same place where they eat. Now I'm sleeping in a latrine." And this is because of the way that it was designed. You can see in the backgrounds again, how difficult the incline and the lack of space and the lack of rails or anything meant that his entire life was essentially confined to a shelter. And what that means, again, in the access to the most basic of rights. A core issue here, and I'm sure this will come up again and again in what the other panelists will say, but it's around the exclusion of older people from beginning to end in the planning of humanitarian response. It is, more frankly, it's discrimination and the lack of seeking out older people's views to better understand their needs and how to respond to these crises. And again, a quote here from an older woman in Northeast Nigeria who has a spinal condition that meant that she was largely confined to her shelter. And she said, quote, "I'm an older woman, no one cares about me. I can't go there to the distribution and they won't come to me. No one is paying attention to us. No NGO has come and asked about my situation." And it's something that I hear again and again in my interviews in different places where we've done work, is that oftentimes the older people that we're interviewing have never before been interviewed or spoken with in terms of understanding their specific needs and then how to guide a humanitarian response. And how could you ever, again, build what's needed in terms of meeting their specific rights and needs if you've never listened to them in the first place in order to understand in the programming. And there's a number of ways that this comes through, but the last one that I want to focus on quickly before concluding is specifically around access to health services in humanitarian crises. And this is something that I've seen similarities across conflicts, across crises, where chronic conditions are very rarely part of a humanitarian response. Whether it's high blood pressure, diabetes, chronic lung conditions, that there's very rarely any sort of medication or otherwise an inclusion of these issues when developing a humanitarian response. And the result, as you can see from the quotes here from another Rohingya refugee in Bangladesh, is that very often they then have to sell part of their food, part of their ration in terms of blankets and other goods. They're having to pick and choose among their most basic rights, giving up on food, which is already limited, in order to be able to get essential medication because it's not provided for in a humanitarian response. And a very, again, similar quote from Northeast Nigeria, where she says, if we go to the clinic in the camp, it's just drugs for emergencies, malaria and things like that. For what we need, we have to go to the hospital and pay for it. When they refer us to the hospital, we don't have money, so we just stay at home. So many of my friends, other older people, have died because of this. And while I focused on health here, this is similar across the board. If we're talking about food, often it's designed in a way that's not accessible for older people or not meeting the specific dietary needs of older people. When it comes to sanitation, access to latrines, in places where HelpAge operates, I've seen incredible construction of latrines that are accessible, but all too often, that's not being mainstreamed across the entire humanitarian response, which means that latrines are not accessible to older people. These things have to become systematic in the way that we're designing humanitarian response. And so to conclude, some final takeaways in terms of the humanitarian response to crises like these. Number one, above all else, is the need for much better inclusion in the collection of data and then in the disaggregation of data that's used to really design all aspects of response after. If older people are invisible at this first stage when data collection is being done, it undermines everything that comes after it in a humanitarian response. The second is the need for training and preparedness to recognize and to respond to the specific risks that are associated with older age and to meet the specific rights and needs of older people. And that a lot of the problems in humanitarian response are linked to problematic assumptions about older people. There's often assumption that older people will be cared for by others, by their adult children, by their grandchildren. The reality is, in many humanitarian crises, there are large numbers of older people who are living alone. There are large numbers of older people who are acting as primary caregivers for others. And even when they do have adult children nearby, they're not always taken care of by those older children. It puts them in a position of dependence when we have this assumption of being cared for. And we need to move away from that idea into one that is rooted in the individual rights of each and every person and responding to that, again, with the specific rights and needs of older people being met. And lastly, that just a center-based response, something that is rooted in the idea that you have to get to a centralized distribution point or health clinic, it fails to meet the needs of many older people. And that too often that is how humanitarian response is done. There's a far greater need to recognize the individual risks that each person faces and to respond to those, whether that's through mobile teams that are going shelter to shelter or otherwise to meet specific needs. And to conclude, just to say that, I think what's happened over the last 18 months and the pandemic and the horrifically disproportionate impact that it's had on older people, if there is any silver lining is that it is shine a spotlight on something that has been ignored for far too long, and that is the disproportionate impact of on older people with many of these things and the discrimination that they face. And so I think this is a hugely important moment coming out of the pandemic, hopefully, to recognize that discrimination and to begin to build systems that respond to the specific needs of older people. I'll stop there. Thank you very much.
Thank you very much, Matthew Wells. I think you paved the way for our further discussion because you brought us to ground reality, particularly Rohingya camps in Myanmar and the border also Bangladesh and also North Nigeria. We are going to discuss more the following presentation, more normative analysis and policy analysis. I think but your presentation is so important because we always have to remember the ground reality. That's a starting point, you know. So it was so contrast listening to your presentation, see the pictures, the images of ground reality while we are sitting in the nice hotel, you know. This is a reality today, you know. So thank you for reminding us of the reality on the ground once again. And also some of the takeaways. I think there are a lot of information contained in your presentation. Let me highlight, you know, two types of takeaways. You know, first part was humanitarian crisis on the ground, and the second was humanitarian response. So I want to pay attention, especially the planning, the better planning and a life cycle contextual analysis and special attention to land and psychological care and so on. I think these are the very, very important the lesson learned from your presentation, which is a result of decade-long practice on the ground. And this can be linked to the next presentation. And I will give you some questions later on after listening to all the presentation, particularly as a practitioner, how do you respond to the presentation on normative and also the policy analysis of the situation of human rights of older persons? So let's go to the second presentation. Dr. Ken Bluestone, he's the head of policy and influencing the Age International, which is a very well-known international NGO on the human rights of older persons. Good evening, good morning. Where are you? Are you based in London now?
I am. Yes, I'm in the UK, right?
It must be early morning, right?
It is indeed.
I hope you are okay.
Really good to be here.
Thank you for joining us once again, in spite of a difficult time zone. Okay, so you have about 20 minutes to present the report, which can be also very interesting for the old audience. Please go ahead with the 20 minutes. Over to you.
Thank you very much. So can I just check that you can see the first slide? Yes? Okay, great. So look, I'd just like to begin by thanking you, the organizers, for creating this forum and for allowing us to share our experience in this panel. Age International, as you said, is the UK member of the Help Age Global Network, and together with Help Age, we carried out an analysis of how older people's rights were upheld in humanitarian crises and whether their needs were being met. This research was done before the coronavirus pandemic struck, but its findings are just as relevant today. And indeed, I think we're going to see a lot of similar themes emerging from the presentation that Matthew has just given. We undertook this research and produced the report because, as this ASEM forum is showing us, both the number and scale of humanitarian crises is growing, but also the proportion of older people being put at risk is growing as well. Crucially, the report is necessary and the research is necessary because older people continue to be let down by the humanitarian system that is supposed to meet the needs of all those at risk. Despite multiple international promises and commitments, the rights of older people in these contexts still aren't being taken into account sufficiently. There are various international commitments to protecting the rights of those most marginalized groups in times of humanitarian need, including older people. The Sustainable Development Goals commitment to leave no one behind, In 2015, the Sendai Framework for Disaster Risk Reduction was also agreed. In 2016, the World Humanitarian Summit, and which included as part of that an inclusion charter that was signed by more than 40 humanitarian organizations, including government donor agencies and leading humanitarian providers. And various acknowledgements have happened in the UN General Assembly and the Human Rights Council that need to do more to protect older people and other marginalized groups. But despite all of these good intentions, the humanitarian system is still not doing its job to protect and help those older people who are at risk. Even now, even when the coronavirus pandemic was emerging, and where all scientific evidence pointed to older people being at highest risk of serious illness and death, the first UN Global Humanitarian Action Plan did not include older people as one of the groups most affected and at risk from COVID-19. So it's clear that the humanitarian system must and needs to do more. We carried out our research. The report draws on findings from needs assessments that were carried out by HelpAge International in 11 countries across Africa, Asia, Latin America, and the Middle East. And in total, we interviewed, as you can see, over 8,800 people between the ages of 50 and over the age of 80. And these were people who have been affected by various humanitarian crises, natural disasters, conflict, or even socioeconomic crises. So what did we find? In brief, despite the excellent work that is taking place across the world to tackle a multitude of humanitarian crises, despite the commitment of humanitarian actors to the fundamental principles of humanity, neutrality, impartiality, and operational independence, older people's basic needs are not being met. In the research we undertook, we found that 64% of the people we interviewed didn't have enough to eat, 77% had no income, 20% had no access to shelter, 25% had no access to safe drinking water, and 62% had no access to bathing facilities. These figures point to a humanitarian crisis. But it's important to recognize that as well, that this is not gender neutral, and that older women are actually more affected by these issues than older men. And we must really take that gender analysis into the work that we're doing and think carefully about how do we ensure that older women and men's needs are accounted for. But as Matt has already pointed to, the issue of data collection and analysis is absolutely crucial. And underpinning the lack of meeting these basic needs of older people in this context was a failure of the humanitarian system to consult with older people and to gather data on their situation. Of the older people we interviewed, 77% had not been asked by any other humanitarian agency about the services provided to them. And 69% did not know how to make a complaint or provide feedback. So that accountability loop was completely absent. And in terms of the UN system, the humanitarian system's responses and their plans, 3 out of 11 of the needs overviews and response plans in the settings where we did our research, only 3 out of 11 included data on older people. At the heart of a human rights-based approach to humanitarian action is recognizing the people who are affected, recognizing their inherent humanity, and allowing them the dignity to have their own experience to be understood. Sadly, this is where humanitarian response is often at its weakest. Even now, new research that is being prepared by HelpAge but is not yet released will show that despite there being guidance to disaggregate data by age and to include older people in the UN's humanitarian response, this simply isn't happening in practice in humanitarian needs overviews at country level. This is due in part to the chronic weakness in data systems, but it's also about the enormous pressure that humanitarian actors are facing to prioritize in the context of declining resources. This can result in focusing on populations that are larger in number or more visible. And sadly, older people may not be seen as warranting the extra time and cost for data collection and analysis. But as Matt pointed out in his intervention, that even though the proportion of older people as part of the overall population may not be as larger as some groups, we are talking about thousands and thousands of people whose lives are daily put at great risk and whose responsibility it is the humanitarian actors in general is to make sure that they get their rights are being upheld as well. With a lack of sufficient data, humanitarian actors and decision makers often have to rely on assumptions, and these assumptions may not be accurate. While we may like to think that in times of emergency, older people can rely on their families, and this again is pointing to comments that Matt has made, our research showed that many older people living that we interviewed were living alone, so did not actually have that support of family support. And again, older people that we interviewed also spoke that the actual system, the humanitarian responses itself, were increasing their dependence on others, undermining their own human right to autonomy and independence. And they expressed concern about this. But most pernicious of all is an underlying ageist attitude that perhaps colors many of the decisions that are affecting older people and the way that the humanitarian system is responding. And that is to say that older people are assuming that older people do not contribute to their families and communities. They are assuming that they are solely dependent and do not have agency. It's our experience of working with older people in even the poorest and most difficult situations across the globe that this could not be further from the truth. And this is typified by the example of Cholpur, a 63-year-old refugee from South Sudan. Despite having to flee South Sudan to Ethiopia in 2016 with her 5 children after her husband was brutally killed, she has been elected leader of the Older People's Association in the camp where she lives. And Cholpur's story shows us that what it shows us is that older people, even in the most difficult context of refugee camps, can self-organize, can take responsibilities for themselves and advocate for others. Older people are not passive. These are people, there's a huge diversity, of course, to the experience of being older. And sometimes, and we are often dealing with situations of people who are living in extreme contexts and living with disabilities that does put them at greater risk and does require them to have greater support from others. But even when they are at risk, we shouldn't assume that they are passive, independent people who are a burden to society. Chol explains that though there are a lot of remaining tasks, I see a glimmer of hope, and I see older refugees' lives being rebuilt. And she really captures this sense of older people taking responsibility and trying to improve the lives of their community and as well as themselves. But coming back to how the humanitarian response is supporting older people in these situations, unfortunately, the lack of specificity, not taking specific needs of older people into account, means that blanket approaches to humanitarian response are put in place. And in those contexts, the well-being of older people is truly suffering. Of the people we interviewed, 98% had at least one health condition, and Matt pointed to the importance of recognizing chronic health conditions in the health side of humanitarian response, non-communicable diseases. And half of those that we interviewed said that there was no medicine available for the conditions that they were suffering from and that health services were too expensive. It's also important to recognize that the intersection of age and disability is acute in later life, with 40% of older people having at least one disability, and that this has a direct impact on the ability of older people to access help even when it is available, to get assistance from distribution points. 39% of the people overall of all age groups, 50 and over, were unable to reach distribution points independently. But when you disaggregate this by age, you look at the situation of older people aged 80 and over, and 70% of those people were unable to reach these distribution points independently. Since this report and research was published, we are still struggling to see the systemic change necessary to take older people's rights into account in humanitarian settings. Failure to take action is a serious breach of older people's humanitarian rights, human rights, as well as a breach of the humanitarian principles that all humanitarian actors have committed themselves to. But it also undermines the quality and accountability of humanitarian response, as well as putting more lives at risk. So to make the changes necessary to improve the humanitarian response for older people, we believe that 4 key steps are necessary. First, governments, humanitarian leaders, decision makers, and organizations responsible for humanitarian relief must provide the leadership necessary to their partners and staff. They must make it clear that humanitarian principles cannot be achieved without taking into account the rights of older people. Second, humanitarian actors and agencies must take responsibility for responding to the rights and needs of older people alongside the work of specialist agencies. So we must mainstream older people's inclusion. Third, this can only come about if data and analysis is strengthened. And this is a point that Matt made very, very well in his own presentation, and it's important just to re-emphasize that accurate information is essential for upholding humanitarian principles and basic human rights. But finally, if we do not place the inherent dignity of older people front and center in our response by consulting them directly, we will have failed to uphold the most basic of human rights principles, but we will also be undermining making humanitarian interventions more effective. Thank you very much.
Thank you very much, Ken Bluestone, for another excellent presentation. It was very helpful for us to understand ground reality once again. As you know, previous session talked about 2 specific realities. There is a Rohingya camp in Myanmar, Bangladesh, and also North Nigeria. But his report, the title, "If Not Now, When?" Very compelling title, brought us to the broaden our perspective. The 11 countries, as we see in the report, starting from Pakistan, Yemen, Ethiopia, Tanzania, Mozambique, Malawi, Zimbabwe, South Sudan, and Jordan, Northeast Syria, and Venezuela. So we now have the really global understanding about the ground reality in terms of humanitarian crisis, especially the older persons. So with these 2 presentations about reality on the ground, now we are going to talk more normative and also policy approach. So for this, I have the distinguished expert, Dr. Chang Eun-ha. She's a director of Korea Women's Development Institute, and especially the Center for International Cooperation. Dr. Chang, we have also 20 minutes, please. Yep.
Hello. Very nice to meet you, and thank you for inviting me to speak at this very important session. I come from a Korean Women's Development Institute. This is a government institute dedicated for policy and legal research for gender and family issues in Korea, but we do a lot of international researches, ODA research projects, and development cooperation. Let me explain a little bit about my background, and that may actually add on to my presentation today. I have been studying humanitarian assistance, especially in conflict, for the past more than 20 years. But it was the first time, actually, that I was approached to speak at this kind of a conference on the topic of humanitarian aid and older people. So during my career, it was always in my mind that why no one talks about really older people in humanitarian context, especially during conflict and also natural disasters. I knew that HelpAge International was very active on the ground, and they were like the main major advocate for older women's rights and also their assistance. But it's not really openly, it has never been like a global agenda, this older people's rights, assistance, their needs, especially during the humanitarian context. So I was very surprised, yet I was very happy that now this topic is addressed, especially in this global international conference. And it was actually my first time to actually look deep into what was going on. And especially because now I am in a gender institute, I'd like to, in this presentation, give you a little bit of gender perspective and how that complicates all this already very complicated situation. Let me first give you a brief introduction about the situation of older women in humanitarian crisis. So my main point is that gender inequalities continue into older age and are compounded by age-based inequalities. So older women face multiple barriers and discrimination, not only barriers, but discrimination, shame, stigma, normalization of violence. Previous speaker have talked about this woman who has faced more than 4 times of humanitarian crisis during her life. Lack of awareness of services because they don't know where the service is provided, and they cannot actually go to the service sites to get access to some of the food, non-food items, shelter, etc. The intersection of gender inequalities with other characteristics such as disability, poverty, marital status. Many people are widowed during the conflict situation. Literacy levels can accumulate over time, a lifetime, and be exacerbated in older age. So here, I'm emphasizing the intersectionality of the vulnerabilities. For example, the illiteracy, a woman who cannot read. 72% of older women surveyed in this survey by HelpAge could not read or write. So if you compare this number to older men only 35%. One of the few studies inclusive of older women in situations of protracted displacement was conducted in Eastern DRC by Oxfam and HelpAge International 2010. And it revealed that over 15% of these seeking health services for sexual violence were over 55. So here now I'm talking about gender-based violence in these settings. Our previous speaker mentioned briefly about this. We assume that these don't happen to older women, but it does happen to older women. Women over 49 experienced rates of sexual violence on par with the rest of the population. So it's really hidden. GBV in the first place is hidden. It's really, for women and girls, it's hard to report their cases. And for older women, it becomes harder because of all the things that I talked about. They are not very well in terms of health. They cannot read or write. They cannot move. So all these difficulties actually worsens older woman's situation, especially when she became victims of gender-based violence. However, here I talked about all these vulnerabilities, But older women can contribute and they are contributing to community with their reproductive, productive, and community roles. For example, reproductive role, they are the main caregiver. So they provide unpaid care work for family members, grandchildren, etc. Productive role, unpaid work in the household, unpaid work in the community, informal economy, they sell little things on the street, etc. Community work, they are actually involved in many community-led initiatives, and some of the cases were found in NGOs on the ground. Okay, these are research. This is a very rare research. I had a very difficult time finding older women's situation in humanitarian settings. There are lots of research on women and girls in humanitarian settings, but when you add one more layer, which is age, it was very hard to find the specific research that considers older women. But here, the Help Age International, here are some statistics that show how older women are far behind older men in terms of many aspects. So for example, in protection-wise, about 6.26 of older people, and among them, about 73% of women reported experiencing at least one type of violence. So in terms of violence, women are becoming victims. And in other assistance items, if you actually go and look into some of the statistics, it shows that women are more affected by these difficulties. I'll just skip because I'm taking too much time. Now, I'd like to talk a little bit about GBV in more detail. So, against our assumption, GBV are happening against older women in humanitarian settings. Older refugees are often overlooked or not identified in data collection in the base. So it's not only older women, but older men as well. They are overlooked in terms of data collection. Risks and needs assessment in regards to violence and abuse, they often focus on girls and younger women only. Older women are often excluded from unable to access the services, the humanitarian services. And it's very little is known about the gender-based violence against people over 49 because not many programs include these populations in their GBV response programs. Only anecdotal data, anecdotal stories on GBV is existing. It was very hard for me to find any sort of anecdotal data either, not mentioning the statistical data. So these are unheard, unseen. Serious abuses such as rape and gender-based violence go unseen and unchallenged. So situation is not very good, right? The experience, but there is not much being done. That's what I want to mention in this slide. So experiences of older women remain largely invisible, despite often facing both gender and age-based discrimination. So the major problem is that we don't have that disaggregated data, very detailed, that considers gender, age, and disability. Because if you have this kind of data, it's really, it becomes easier to identify older women because old is age, woman is gender, and disability because many older people face a similar situation with disabled people. So if you have this data that considers these three elements, it becomes much easier to find their needs. So invisibility of older women's rights, experiences, and needs, and the lack of specific frameworks to protect this is a huge problem right now in dealing with older women in humanitarian settings. I found this little photo from the internet that kind of really touched my heart by, again, Help Age International. One Tanzanian activist reported that, unlike other crimes, violence against older women is accepted. older women count too. So I think it's really time that we start to look into this issue, GBV for older women. I'll just, because I'm just continuing what I've just mentioned in previous slide, I'll just continue to read what I have on my slide. So taboo and stigma that often surrounds violence faced by older women is likely to lead underreporting, just as I mentioned. The lack of data and knowledge on the types, drivers, perpetrators of violence experienced by older women may lead to a lack of appropriate prevention and response strategies. Factors that increase the likelihood of exposure to violence among women include poverty, low level of education, and non-employment. So if you survey older women in this humanitarian settings, a lot of them are illiterate. And just imagine how this illiteracy could affect all the complications that they already have. So I've suggested some more statistics in next sentences, especially many women are widowed in this situation. So that makes their economic situation harder. When I was preparing these slides, it was extremely difficult to find, as I said, exact statistics that shows the situation of older women. Not only statistics, but it looked like older women in humanitarian settings, their specific needs is being neglected. So these are some of the measures that I've actually thought about for a long time and came up with some of these suggestions, combining all the reports that I read, also by Help Age International, etc. So first of all, as my previous speakers have spoken about, we really need an inclusive response to older persons in humanitarian emergencies, including guaranteeing their access to the services. We need to consult them when we do the needs assessment analysis. Not only that, we need to find out how they could actually participate in these humanitarian aid efforts. And also not only that, but we really need their feedback in monitoring and evaluation phase. And I'm going to explain in more detail how we can do this in my next bullets. So in humanitarian settings, even though when we do the needs assessment, it's really emphasized that we do gender analysis, even in humanitarian settings. Even if this is a rapid assessment, it's required that we do the gender analysis. And now I suggest that not only gender, but we also need to include age. So I suggest gender and age analysis should be done. And here, I suggest that it's not only, we've listed so many vulnerabilities in my slides as well, but I really would like to emphasize that we need to find out what capabilities these older people, and especially older women, have in the community, in the family, because that's about their dignity. So I've thought about little roles that older women play, mentor, especially for the girls and women in reproductive age, because they have gone through. And also, we talked about caregiver role. This is a very important role where, especially during conflict, where many men are out there fighting or they migrate other cities to earn money. So it's their caregiving role. And also, you find in these communities that older women work as, they have the skills to attend birth. So in this, even in this like refugee camps, older women play a great role in attending babies. So I don't know like which kind of role they play in each community. Maybe they have a very different, very positive role. So when we do this analysis, I really strongly encourage that we find out their capabilities in the community and the family. My third bullet is I suggest that we really should take a rights-based approach, and this is what our previous speaker talked about, the dignity. having like only like latrine and kitchen and sleeping space in all in a little tent. This is not a dignified life. So when I talk about rights-based approach, it's really important that we give them some sort of choice about where they are going to live, how they will be living. I know it's very difficult in humanitarian settings, but if you, as someone who plans these programs and projects, if you have this in your mind to begin with, I believe this kind of approach will actually result in some different outputs in the end. Next, especially for women, this is very important, and I think many women in this room agree, a life cycle approach. And this is not only in humanitarian settings, but I know that in domestic policymaking as well, life cycle approach is what like gender policymakers are arguing for. Women goes through, because of their reproductive roles, they go through vastly different stages of life with their changes in their body. So I think this should be very much considered, especially like women after going through menopause, after menopause, and also some people talked about psychosocial illness. We really need to take that into account as well. And the next, GBV issues, I won't go into in more detail, but we really need to assume that these are happening to older women too. And unfortunately, there are possibilities that humanitarian practitioners, workers, they may be exploiting the older woman. So unfortunately, and it's very sad, but I strongly encourage that practitioners and policymakers all assume that these are happening. And then my next point is about gender, age, and disability, disaggregated data that I've talked about in my previous slide. I actually have one more thing to say, which is an example of how gender and age intersect, and then that creates further vulnerability of older women. I'd like to introduce this illness, eye disease, trachoma. I have a good eye doctor friend, and when we were talking about some gender issues, he introduced me to this disease. There is this disease that's really prone for women, and especially for older women. And he introduced me this disease, and many people already may know. This happens not only in humanitarian settings, but in peaceful times as well. Trachoma is a preventable infection that impairs the vision of so many people worldwide. And some people actually go blind because of this eye infection. When doctors actually examined this, they found out that women were 1.8 times more likely to have this disease. And they were questioning why. This disease looks very gendered. Why? This is a waterborne disease. So contaminated water causes illnesses for all, but women and girls, they are more affected, and especially during this COVID-19 pandemic where the water, sanitation, hygiene becomes more important. And my last slide explains why this happens more to women, and especially older women. So over the course of the lives, women spend more time with children than men. And this disease, trachoma, the germs, it's transmitted easily by children for some reason. So who are taking of these children? It's usually sister, young woman, mother, and then in later life, like grandmas, right? So this becomes a very gender-specific disease, and they become exposed to these germs. So if you look at this, the picture, when woman becomes old, the likeliness of having this disease becomes higher because woman played this role as a caregiver during her life cycle. So I'm giving you this as an example that when we do needs assessment, even in humanitarian settings, we really need to look for this kind of illness that, or disease or situation where gender and age intersects and creates further vulnerability. That's the end of my presentation. Thank you.
Thank you very much, Dr. Chang. Let's give a big hand for her. So thank you for another excellent presentation. I was wondering whether you have found a common among three presentations. We have a presentation by Matthew, Ken, and Chang. And of course, there are many common words among three presentations. For me, which was not striking, but which is very interesting, is data. Data was the word by the three speakers, because through data we understand ground reality. Through data we can develop policies. Through data we can develop relevant norms. So I think data is very, very important, but probably the older person, as the experts presented, the data is one of the biggest challenges to address the human rights of older persons, particularly in humanitarian crisis. This intersectionality, this is a very popular term among experts, but not so much popular among ordinary people. So from ordinary people's point of view, it's a common sense. Not every older persons are discriminated. Not every children is discriminated. Because when it comes to intersectionality, because not only they are older person, but also they are minority or person with a disability or something else. So in that sense, I think the intersectional approach is very important in order to understand ground reality better and also more contextual manner. So traditionally, as you know, we have the human rights-based approach, and there was a gender-based approach, or gender-sensitive, or responsive, or gender-transformative approach. But when you bring this together, gender, age, especially from the age point of view, life cycle approach is also a contribution to the human rights-based approach. So they make it more inclusive of the older persons. Thank you for helping once again to learn about this important approach. And now we are moving into the last presentation, which was very interesting because it's a normative and policy practice. So we have listened to two presentations about ground reality through the report and research, and also this policy tool about intersectionality. And before we have the last presentation, I'm going to let the two previous speakers. One of the questions I'm going to raise during the Q&A session or interactive dialogue is, what is your response to this intersectionality and a normative framework from your own experience as a practitioner and the researcher on the ground? So you can prepare for that question. So now, happy to introduce the last speaker, but not least, Supriya Akerkar. You're also London, right? Where are you? Are you in London or unmute, please?
Yeah. I'm based in Oxford.
Oxford, also is UK, right? UK. So must be early in the morning. Thank you once again for joining this program. I know this is a very difficult time for you, So thank you for staying with us. Okay, so you have also 20 minutes for presentation. Okay, over to you.
Yeah. Okay, so I'm going to start with the sharing. Can you see the slides?
Yep.
Okay, thank you very much. First of all, thank you very much for inviting me to this ASEM forum on human rights of older people. So, and a big congratulations for the organizers in not only this session, but also organizing the whole conference. So my presentation is going to be about older people in humanitarian crisis, but I'll also be focusing on discourses and the current normative frameworks that we have, the gaps between policy and practice. I work at Center for Development and Emergency Practice, 옥스퍼드브룩스 University. I'm also the course leader for the master's program in Development and Emergency Practice. So it's quite possible that I may be, reiterating some of the facts that the earlier speakers have spoken, but that's not a bad thing. So again, let me start with a very brief context analysis. We know that today more than 21% of the population will be over 60 by 2050, and so that's a trend that we understand. And we also know that there are more older women for every 83 men, there are every 100 women over the age of 60. And 46% of these older people also have a disability. And again, what this all means is that older people are a very diverse group, and they have a lot of diversity of experience, knowledge, and skills. With the fact that some of them may be women, men, again coming from different occupational groups, and also abilities. Now I'm just going to give you a very short sort of snapshot about older people in humanitarian context, and just to highlight some of the issues that perhaps the earlier speakers may have also spoken about. Now we know that in the last 2 years there has been COVID-19, that's a major humanitarian crisis, and a high disproportionate deaths of older people and people with disabilities have been observed. And 40% of those deaths have been from the care homes. So that's in itself is a big issue. If you go to the tsunami in Japan in 2011, we again find that 56.7% of the total deaths were of people above 60 years. Then if you go to Hurricane Katrina in 2005, again we find that 75% of those who died in the wake of Hurricane Katrina were 60 years or older, although they were just 16% of the pre-hurricane population. If you go to the 2003 European heat wave, it led to 53,000 deaths, of which majority were elderly. In South Sudan, elderly refugees over 50 years were dying at 5 times the rate of those aged between 5 and 49 years. And if you go to Nepal earthquake, the food, we again find that there is evidence that the food aid was not responsive to the needs of the older people, and the shelter and the wash infrastructure was also not disability inclusive. I think the earlier speakers have also mentioned, I think it's quite important to understand the overlap between the situation of older people and people with disabilities, particularly because more than 40% of older people do have at least one disability. We also find in relation to the Syrian refugees, this is in Lebanon and Jordan, 10% of the Syrian refugees were with disabilities, and again, those specific needs went unmet. And a SENDEP ActionAid Philippines participatory assessment study, which we had done in 2015, had also shown that older people and people with disabilities were unable to access the livelihood opportunities, cash for work after the Typhoon Haiyan in Philippines. We also find that although typically older people and people with disabilities constitute 25% of the typical caseload, they are often invisible, and a HelpAge study also found out that out of the 6,003 analyzed projects, only 47 or 0.78% included at least one activity targeting older people, and only 13%, 18 of those were funded. So again, it shows a very high underrepresentation of the of responses to older people in the mainstream humanitarian organizations. And one of the important findings by the Interagency Standing Committee in 2010 was that humanitarian response, continued to marginalize the needs of older people and people with disabilities. So, I mean, in a way, it sort of summarizes a lot of the things that I've spoken in the earlier slides. So, what does it really say? I mean, the fact that you have disproportionate deaths, the fact that older people's needs are not really met in humanitarian crisis, what does it really tell us about the humanitarian imperative that the humanitarian actors are bound to follow, and the human rights affirmation, which is really based on non-discrimination. So if you look at the humanitarian imperative, all people should be receiving the humanitarian assistance without discrimination. and that is the right of the people. You have the Universal Declaration of the Human Rights, which says that everyone is entitled to human rights without distinction of any kind, and prohibited grounds are the color, sex, religion, politics, nationality, or other status. And that part, other status, is quite important because that also brings in age into the domain of the Universal Declaration of Human Rights. But what we find, as you saw from the earlier slides, the case examples that I gave, that the case example shows a violation of both the humanitarian imperative and human rights gap. Now, what may be the reasons for that? So one of the issues which has been highlighted by the IAC has been that there are capacity gaps within humanitarian actors. And this really brings me to share with you to some the project called Age and Disability Capacity Project, which was from 2014 and 18, and it was actually coordinated by HelpAge International, and there were a number of organizations which participated into this initiative. And CENDEP, Oxford Brookes University, was a research partner for ADCAP, and I was involved as a lead researcher to understand what were the learnings from this initiative. So I'm going to share some of the learnings that we have gathered from this study, and as a part of that, we had also published this good practice guide embedding inclusion of older people and people with disabilities in humanitarian policy and practice. So that brings me to some of the highlights as to why is it? What is it that leads to the marginalization, invisibilization of older people and people with disabilities in humanitarian responses? So ageism, again intersecting with disabilities and gender, and as earlier speakers have also pointed out, that just means that if you're an older woman with disabilities, your discrimination and marginalization is compounded. And then there are certain discursive assumptions which are made by the humanitarian actors about older people and their operational environments, which again lead to further exclusion and marginalization. And unfortunately, in many contexts, these discursive assumptions are often normalized rather than critically questioned. And that is a part of the problem. So what are these discursive assumptions? A, that they are not mainstream. What I mean by mainstream, I should have put it in the quotation marks, is that, in many contexts, the typical person of the humanitarian aid is considered maybe to be the younger adult, younger male, but that just means that, that older people, older women and men are excluded from the mainstream institutional responses and services, whether it is health, education, vocational training, among others. The second discursive assumption is that, well, older people are vulnerable. But that doesn't really help us if you're going to look at older people as vulnerable, because what it does is to contribute to the idea that older people and people with disabilities do not have capabilities and the agency of their own. It denies voice to the people with disabilities. They are denied participation. They're often represented by others. And more importantly, just to call people vulnerable can also deflect from the larger context which leads to their vulnerabilization. So it deflects attention from the causes of their structural exclusion, the different barriers that make their participation difficult and invisible. The discursive assumption 3 is that, well, older people are unproductive. They can be objects of pity and right, but not of rights, and so excluded from livelihoods and other programs which are initiated by humanitarian organizations. Discursive assumption 4, well, this working with older people needs specialist work, so it's best that we leave specialist organizations such as HelpAge International who are equipped to work with them. We really can't mainstream their needs or responses to them in our work. But what is really this whole idea that only specialist organizations are equipped to work with them leads to is that they are marginalized from the work of mainstream organizations, and also the whole humanitarian cluster systems around which the humanitarian response work takes place. Discursive assumption 5 a belief that we are already working with them. Well, some organizations think, well, we are working with older people, but and so they are inclusive. But that doesn't again help, because what you really need is an understanding, a contextual understanding of the barriers. And if you do not have that understanding, then your lip service may continue, and lip service to older people may just continue. Discursive assumption 6, that they are poor value for money. Well, there is an assumption that it needs a big budgetary allocation and increased programming cost, and therefore this is really poor value for money. So again, so what enabling inclusion really means is that, we should be able to, the humanitarian organizations should be engaged in challenging these discursive assumptions and the varied barriers, not being a part of it and not really normalizing all these assumptions. And what is also therefore needed is also mainstreaming inclusion in all humanitarian response work by all organizations wherever they are responding. Now, there are some key guidances for capacity building by humanitarian organizations, which really talk about engaging with these discursive barriers, discursive assumptions, and the different barriers. And I just want to flag out a few. The ADCAP Humanitarian Inclusion Standards for Older People and People with Disabilities, and the ADCAP Good Practice Guide for Inclusion of Older People and People with Disabilities in Humanitarian Policy and Practice. And then you also have other excellent guidances by UNHCR, the HelpAge IFSR, IFRC Shelter Guidance, and the Older People in Emergencies, Considerations for Action and Policy Development by David Hutton, and the Sphere Standards. So, so there are a lot of guidance already available, which suggests as to how can one engage with the discursive assumptions and also the different barriers which lead to the exclusions of older people. So that's about the what's happening out in the humanitarian sector, the capacity building guidelines and the analysis around that. Now I want to talk a little bit about the existing normative frameworks, and I'll speak as to how I have sort of matched both some of the guidance and also the existing normative frameworks for older people. So I've taken into account these few normative frameworks. We know the Universal Declaration of Human Rights, which really highlights the principle of discrimination, the convention, and then you have specific normative frameworks such as the convention and the protocol relating to the status of refugees. You have the Refugee Convention, OAU. You have the Madrid International Plan for Action on Aging, the UN Convention on Rights of People with Disabilities, the CEDAW recommendations on older women, and the Inter-American Treaty on Human Rights of Older People, the Global Compact on Refugees, then the EU Directive for Refugees, and the guiding principles on internal displacement. So all of these different normative frameworks have some things to say on humanitarian context and older people. So what I've done is to map out some of this and to really look at the interventions which have been suggested by these different UN-led normative framework or other regional normative frameworks. So what when you look at the interventions which have been suggested by these normative frameworks, there are quite a few which are given, and they're quite good. So they do highlight, if you look at the interventions, they do highlight the equal access to food, nutrition, shelter, healthcare, education, livelihoods. Then they also highlight the need for assessments, understanding contributions of older people, vulnerabilities, disaggregation of data by sex and age, involving older people in program planning, making relief workers aware of the older needs, design national guidelines to assist people. And so what I've done is, I'm just reading out of some of these guidances which have been given in the in the normative frameworks. What I've done is to check, to what extent are these normative guidance also sort of, reflected in the guidances that have been developed by the humanitarian sector, the guiding. And so the green highlights that there are currently detailed guidelines available. And in the earlier slide, I'd looked at which are the guidelines that I have looked at. This includes the ADCAP work, but also the other guidances which have been developed by WHO. So the green shows that in relation to the the interventions which have been highlighted by the normative UN and the regional normative frameworks, there is enough guidance available. Then you also have, I have highlighted those guidelines, those interventions which have some guidance but not enough in the blue. So there is some guidance available on protecting older people against violence, assisting older people for economic self-sufficiency, recognizing the potential of older people as leaders, assisting older people in preparedness, reconstruction, and prevention. But then there is a whole list of interventions which have been given in the normative frameworks for which we don't have enough guidance. And that includes protection of inheritance of the older women, reception areas for older refugees, their registration, support to integrate older people in countries of origin, or supporting the host countries to welcome and meet older people, support to older refugees in detention and responding to their health concerns, and adequate standards of living for older refugees in detention. And you'll see that, you know, a lot of the last 4 areas are around older refugees, and there isn't, as of now, good guidance as to how to respond to these issues. So what, if you take into account the earlier slides and the last slide, which had mapped the normative interventions which have been suggested by the UN frameworks or the regional human rights frameworks and the guidance available, then what we can say is that, yes, I think, you know, a lot of the interventions suggested have been good. They have also been highlighted in the guidance documents. However, you know, if you take a look at all those interventions suggested, we still find that they are very piecemeal interventions, and there are significant gaps, particularly if you start to look at, you know, some of the areas highlighted by the ADCAP humanitarian standards and the ADCAP good practice guide around on inclusion of older people and people with disabilities in humanitarian responses. I mean, these are you know, latest insights on why exclusion happens, and they highlight a number of barriers, and none of these barriers and engaging with these barriers are still reflected in the UN normative frameworks. And I just want to sort of highlight, you know, the case of COVID-19 to speak to as to why, you know, to speak to as to how the current frameworks really do not sort of, you know, speak to the issues of barriers and some of the discursive frameworks. So, for example, if you go with the case of COVID-19 in humanitarian crisis, we see that there have been a lot of discourses which have normalized deaths. Now, this is just a photo from a USA, in USA, in one of the, I think, mobilizations, and it says sacrifice a week. So there has been a lot of stereotyping of people with disabilities and older people as less useful burden to the society, with an underlying message that it is acceptable for the groups to die. And people in authority positions, for example, a former health minister of a country has said that people over 64 are already corpses, and government should focus its COVID-19 efforts on people who are still alive. We also find that, you know, during COVID-19, their discriminatory principles were followed, and the COVID-19 humanitarian response has been singularly discriminative, and that includes older people being en masse and singularly targeted for restrictions on their movement. Now, this may be well-meaning interventions, but at the end of the day, it was a case of medical-based advice trumping the rights of the individuals in arbitrary ways. I may be 60, 65, and I may be perfectly healthy, and that doesn't mean, therefore, that, you know, I should be restricted for my movements. There were also inadequate standards of care and regulations in the care homes. And then there were a lot of instances of everyday struggle, discriminations, and violations, where older people did not have, again, you know, access to food, insecure livelihoods, mental health issues, among the others. And so what we find is that, again, in COVID-19, the agency, the right of the older people to be consulted, the recognition that older people's lives are valuable and that they are not dispensable, accessibility, all these rights which should have been, in principle, affirmed by the governments and the humanitarian organizations or all organizations responding to them were being violated. And in effect, we can again say that the right to non-discrimination and the equality rights were singularly violated in COVID-19. So again, I just want to, the main takeaways that I really want to highlight is that the discursive assumptions and the barriers which were identified by the ADCAP initiative as capacity gaps continue to hold strength even today. The current UN-led and also the regional normative frameworks, they have some good interventions, which have also been highlighted in the guidance documents by humanitarian organizations, but they are not sufficient. Protection and elimination, protection to eliminate the barriers, to affirm the equality rights of older people in humanitarian crisis. At the most, they can be considered as good, but very much sort of a piecemeal suggestions. And therefore, I think it is only right to say that the UN Convention for Older People to protect their dignity and human rights has to be the way forward. So I'll stop over here. I hope I've not exceeded my time. Thank you very much.
Thank you very much, Supriya, Akerkar, for another excellent presentation. I think you help us a lot to understand this complex issue of the older person humanitarian crisis from practice and policy, and especially the normative framework. I think your conclusion was very clear, And also, it's not only you, all the presenters, from your presentation, I can make a common conclusion. Our response, humanitarian response on the ground is not enough, policy framework is not good enough, and also normative framework is not good enough. So what to do, There are so many issues here on the table. And also I found one common word, Previously I said that data was a common among three. Can you guess what is a common among all four of you, It's very interesting because you made a separately your own presentation. The common word I found was assumption. Everybody talking about assumption, That means there are a lot of prejudice or wrong or distorted understanding about reality of human rights older persons in humanitarian crisis. So first, the first challenge is how to fight against this assumption, the wrong assumption, That's why the data is so important. We need to provide the disaggregated data so that people can understand reality on the ground, This is, I think, the first common, that I found, from 4 presentations. And so now, as I mentioned, I'm going to ask the first 2 speakers, Matthew, Ken, you have a lot of ground experience through your practice and research. And then last 2 speakers talking about policy framework, intersectionality, and also even the Supriya made a very interesting suggestion. We need the UN Convention. And her presentation, we found only one human rights treaty on older person. There's an Inter-America system. There's only one. Not in Europe, not in Africa. So not needless to say about the UN, So I'd like to ask Matthew and Ken to respond to this question. Why is important this intersectionality, the first one, and the second one is about why we need a UN convention. So like a CRC is very well known, Convention on the Right of Children, and probably Convention on the Right of Older Persons, CROP, acronym, I made the acronym. Okay, so first, Matthew, your response, please. Why is important intersectionality on the ground?
Thank you. And yeah, it's been great to listen to all the speakers. And maybe really quickly to pick up, I think it's great that you highlighted that issue of assumption from all 4 of us, because I think it is so key. And it goes back to, you break down those assumptions by listening to, by including older people in the first place, by involving them. They should be involved in the design of these programs. And it's by the exclusion that we end up with these problematic assumptions. On intersectionality, I couldn't agree more with the other panelists, and that it again goes back to one of the things I tried to highlight, which is that older people are not homogenous. Their experience of conflict is not homogenous. nor is their experience of humanitarian crises. And the experience of older women is often quite different from older men. The experience of older people with disabilities is experienced from those who are able-bodied. And so there is a need always to unpack these intersections of different risks, of different identities, also around, poverty. There are enormously different experiences based on whether one is an older person of relatively high status economically from those who are not. And so all of these need to be examined and unpacked if we're going to design a response that truly meets the rights and needs of older people. And so, yeah, I can't agree more. Very often in the work that I've done in places, you see particular forms of discrimination against older women in particular. And we saw the quote that I had from the older woman in Northeast Nigeria. And very often older women in particular are not included when these sorts of assessments are being done. They're particularly marginalized. And so there's an enormous need to better include older women in particular.
Okay, thank
On
you.
the normative...
Can you make it short? Yep.
Sure, absolutely. Just to say on the normative framework, again, I agree, but I think we also need to recognize that even where there have been normative frameworks in place, that still the response has been woefully lacking. And Ken spoke quite a bit about this in his remarks as well. And that so much of this falls back on resourcing, and it falls back on discrimination and an undervaluing of the lives of older people in the first place. So while we need to build that normative framework and plug the gaps that exist today, there also has to be a much bigger fight around resourcing and an end to discrimination and how we see older people through ageist assumptions in the first place. Thank you.
Okay, thank you, Matthew. Now for Ken, Dr. Chang, she mentioned about several components for intersectionality in terms of age, life cycle analysis. She mentioned about, of course, gender, disability, poverty, marital status, education, literacy, the many, So from your own research, what is your view on this intersectionality from your own experience?
Thanks. And I would like to tie that into some of the previous comments that have been made. I think one of the key things, we're all agreed that actually what we need to be doing is to looking at the diversity of the human experience, that is when we get older, and what we can't do is to separate out a person into separate components. We have to look at the whole person, and that is what we mean by intersectionality, is recognizing what those different experiences are. It only becomes challenging for us when we start to put these different lenses on things, and we start to put obstacles in the place of seeing that person. When we look at the issues of intersectionality and gender, a huge amount of work has taken place over the decades to get the inequalities recognized and to have the contributions of women recognized, and to put in place the tools in which we can begin to understand better what are the economic contributions that younger women are making. But when you add the dimension of age to gender and to gender analysis, what we stopped seeing, and what policymakers stopped doing, is stop looking at the gender dimension. What they only see is the older person. Mm-hmm. And so where you have women's economic empowerment, the economic contributions, the care contributions that women are making, that the role, the activity that older women are doing in this area just disappeared. They become invisible. They are no longer seen as carers, but they are seen as recipients of care. And the question we have to, and the same for disability, where you have a person who is living with a disability, when they become older, sometimes in terms of statutory entitlements, how they are viewed by society changes entirely. They are not seen to be a person that has statutory rights as a person with disabilities, or perceived as a person living with disability that has specific rights, but they're seen as a person who is older. And we need to ask the question, what is it that is giving us the permission as a society to do these things, to make these choices, to put in place these arbitrary choices, this level of discrimination. As you know, the World Health Organization released earlier this year a global report on ageism, and ageism is the backdrop, that sense of that internalized discrimination, both that we all have as individuals, but also that we place on others. And this is where this question of normative frameworks is so important, and why we have to come back to the question of a convention on the rights of older persons and why it is so necessary. It's necessary because, yes, we do need that legal certainty, that clarity about how do we protect the rights of people in later life. But it's about the process of achieving it. And the one thing that a convention can do, which is the process of creating a convention that is different from all of the other normative frameworks that we've seen on the screen, is that it can shift and change the narrative and the perspective of society as a whole as to what does it mean to be older, and shift our understanding of older people from the people that we do things to rights holders, in their own rights and perspectives. Yeah. But Matt is right. It isn't. The piece of paper on its own isn't sufficient. Yeah. What we have to do is to have a process in which we, first of all, involve older people directly in the raising awareness of their own rights, but also in understanding what their experience of aging is, so that we can create the right set of guidance through a new convention. But it's about the process of involving all generations, so that way we
Sorry, there is a connection problem. Okay, thank you very much for Dr. Ken for highlighting the importance of intersectionality, especially the importance of narrative and also perspective on the issues of the older persons in humanitarian crisis. Now let me ask Dr. Chang. There was a question about we need the UN norm, UN Convention on the Right of Older Persons. This is a suggestion from the Supriya. And also we have another global framework, normative framework, which is SDG, the Sustainable Development Goals. Because when you talk about humanitarian crisis, we can approach from the human rights perspective. There is a UN human rights norm. The other one is SDG, because humanitarian crisis is issue of developed cooperation. Because SDG is a general universal framework for developed cooperation. So you have both experience of human rights and developed cooperation. So what is your view of why it's important to bring this issue of the older person humanitarian crisis linked to the UN global norms and also SDG? Do you have any view on these issues?
Yes. Is my mic on?
Oh, press.
Oh, press.
Oh no, press again.
Again. Okay. Thank you for that question. I think it's long past time that we come up with UN Convention on Rights of Older Person, thinking how important this issue is and how we have been so negligent on this issue. As for your question, between or considering this UN Convention on Older People and also SDGs, I certainly think that both two have a reinforcing effect. Why do I think like this? Because thinking about SDGs, the Sustainable Development Goals, and the basic philosophy of this is, as we all know, it's leave no one behind. When we consider no one behind, that includes, of course, older people. In SDG, luckily and thankfully, we have women as a separate independent goal, Goal 5, gender equality and women's empowerment, so that's good. Children, it's actually mentioned, it's not a separate goal, but it's mentioned, I think in goal, the peace goal.
16, goal 16.
Or 16, yes,
yeah.
There. For disabled people, we do mention, we have mentioned here and there, but for older people, I don't see it very clear in SDGs. So in realizing the philosophical background of SDG, Leave No One Behind, making this UN Convention on rights of older people, it will certainly complement SDG spirit in realizing SDG spirit. And just thinking about it, we have UN Convention on Women, the CEDAW, and children, and disabled people, but not older people. So this will be complementing SDGs. Also, SDG will become a philosophical foundation to establishing UN Convention on Older People, because now SDG, everyone knows and we all agree with this leave no one behind spirit. So I think this too has a reinforcing effect, and it has to be actually go hand in hand.
Okay, thank you very much. We have only 8 or 9 minutes left, so I'm going to ask one question to Supriya. After that, question to all, so your final remark. For Supriya, you mentioned about importance of the UN Convention. My question is, this is ASEM, ASEM is composed of Europe and Asia. And Europe, many of European countries belong to OECD, because OECD play a very important role in the policy making of older persons. And from Asia, South Korea, Japan, the member of OECD, OECD has a DAC, Development Assistance Committee, which deals with the ODA. So my question to you is, how we can mainstream your idea, if not UN, first maybe you can try within ASEM countries, Europe, as you mentioned, it's only Inter-American Convention on person is older person. What about Europe and Asia? Then we move to UN. So how to mainstream this idea into ASEM countries first? Do you have any idea and suggestions?
Okay, I think that's an excellent, suggestion, possibly, as a way forward. Yes, I think the Inter-American Convention, has been quite useful, and I think the regional countries have ratified it, and they are really using that convention also to make their own societies conscious, but also using it to further the rights of older people. So yes, I think one way of looking forward is to also have some more regional conventions, which may include Europe and ASEM. And I think when you look at the normative frameworks that I've highlighted, there were some normative frameworks that I also highlighted in relation to the Europe directives and in relation to refugees. And when you look at those normative frameworks which are endorsed by Europe, and I think we find that yes, you have also the European human rights directives. So there are a lot of this, the regional directives presently they are there, but they don't have much to say on the rights of older people. So there's still a major gap, I would say. So yes, in principle, even some of these regional frameworks talk about equality, discriminations, but there is really nothing which speaks about, non-discrimination and affirmation of rights of older people. So I think that's also a very good idea that, you actually take a deeper look at some of the existing, normative frameworks, which I've also highlighted in my presentation. But again, I think they show that there's a very piecemeal approach, and we really do not have enough understanding of or enough affirmation of the older people's rights in those current regional frameworks also, the regional normative frameworks, particularly in Asia and Europe. So I think it's a good example, possibly a good way to move forward. And I think I just want to reflect on one thing that I think one of the earlier speakers, I think, mentioned, probably Ken and Matt, I think, that yes, I think, the normative frameworks can be very powerful in mobilizing older people, mobilizing the public opinion, against the discrimination. And I know that the UN Convention on People with Disabilities, or even the CEDAW Convention, have been mobilized by women's groups, by groups working with people with disabilities, and they have been mobilized to to highlight the rights. So I think they are very significant, these conventions, in mobilizing the public opinion. They give a statutory sort of a framework for affirmation of the rights. And although, of course, that's not enough, I think they can be very powerful in mobilizing, opinion and also public consciousness against discrimination. So I think the UN Convention for Older People's Rights is very much, I think, needed and part of the need for today. And yes, a possible way could be, as you say, the regional conventions.
Okay, thank you. So now the final remark. So maybe you can pose one keyword, and in terms of lesson learned from this session, also take away. You know, I used to teach, I'm still teaching about human rights and SDG in some universities, and then always I raise this question. In the 80s, we have a CEDAW, Convention on the Elimination of All Forms of Discrimination. And early 90s, we have a CRC, Convention of the Right of the Children. And 2006-8, we have finally Convention on the Persons with a Disability. You know? So what next? What next? You know? And then very few people say the Convention on the Right of Older Persons. You know? Many people something else. So that's why I was wondering why. Because you know, it's a logical. We have a children, right? We have a disability and women, and the next one should be the older persons. But many, of course, students, they are young, you know. They are not old enough to realize their future right, you know. Probably that's the way. So that's why you mentioned, all of you, about perception, you know, perception or assumption, you know. So now question, the final, the keyword, Matthew, Ken, in one word, you know, what is the main message you want to ASEM, you know, ASEM political leaders, how to mainstream the right of older persons, including the humanitarian crisis. 1 minute, please. Matthew first.
Thank you. My one word would be inclusion. And the idea is to be that in all aspects of humanitarian response, whether from donor funding to the way that planning is done by UN agencies and humanitarian NGOs, to how everything then happens in assistance being delivered, that there needs to be a specific mindfulness and inclusion of older people in all aspects of the response if we're going to do this better. Thank you.
Okay, thank you. Inclusion. Inclusion is precondition for participation and ownership and so on. Okay, now the Ken Bluestone, please.
I'm going to use 3 words, but I'll be brief. First is practical. Address practical needs. We have to create space in which the humanitarian actors are able to incorporate the lessons that we've been talking about. Second is leadership. We need to have that top-level leadership and that reframing and the environment, the normative and convention that we're talking about, and the third is attitudes and understanding. We must reframe people's attitudes and understanding to older people. Thank you.
Okay, very good. The leadership that has a practical mind and also good attitude. Okay, thank you. Now, Dr. Chang, you have 1 minute.
It would be older people's lens as opposed to gender lens that we talk about, because I was going to say exactly the same thing as Dr. Bluestone just mentioned. We need to do something to change, you know, the normative framework, UN convention, whatnot. That will take some time. But on the ground right now, we need to really fix the situation. So having older people's lens and thinking out of the box that can change, you know, just small change in implementing your project, it could, you know, deliver a different outcome. So, yeah.
Okay, older people, like a gender lens, we need the older person's lens. Okay, Supriya, please.
Okay, so very briefly, I would say end discriminations, and particularly the intersectional discriminations, I think, and affirm the rights. And I want to emphasize the intersectional discriminations, although I didn't say too much, but on that, mainly because it is really important to understand that, you know, intersections really, you know, lead to overlapping discriminations. So you can't really look at discrimination from one perspective. It's a more complex reality, and it's very important to affirm that intersectionality to ensure the diversity that we spoke about. Experiences of discriminations are actually, you know, responded to. Otherwise, you might still have, at the end of the day, a male, you know, with due respect to men, or a young man as the, you know, as you know, when we talk about discrimination, looking from that perspective. And so, very important that we address the intersectionality, intersectional discriminations.
Okay, thank you very much, Priya. If I were to say one word, for me, I would say intergenerational dialogue, intergenerational. It's inclusive of all ages, because as I said in the classroom, this day we are talking about future generation. You know, there was a UN General Assembly, there's a special session about future generation, and BT was invited to UN General Assembly on the session, the SDG moment as well. So, but older people are future generation of young generation, you know. Everybody has to come to this older age, you know. That's why it has to be really extremely with the young people. So more solidarity between the young generation and older generation, I think that can be also a very important strategy to mainstream the age in the international norms and so on, you know. And also, before end, I would like to thank, we practice in this conference the disability sensitive approach. That's why we provide the sign language. So I want to, on behalf of all the participants, express our gratitude to the interpreters, of course, English, Korean, and also especially the sign language, so that more people can join in this session. And also, of course, all the speakers from London and Washington. I know it's a very difficult time zone. Thank you once again for joining this session. So let's give a big hand to all the speakers and those who made this session possible. Thank you.